Hello everyone, myself Dr. Tapas Pal and welcome to our channel Physiomax Organization. Under the part of Physioversity, we are continuing our educational series of anatomy, where in the last class we have already read about the basic portions of the Ostology of long bone humerus, where we came to know about the anatomical position, site determination, bony osteology and the landmarks of humerus. And today we'll be reading now about this bone, that's the muscle attachment of humerus. When we was talking of about the muscle attachment, we'll be reading the muscle attachment into two parts. That is, one in a way which muscles are getting inserted to the humerus, and the another one which muscles are getting originated from the humerus. So remember, before you read about the muscle attachment, few of the muscles which are directly coming to the humerus as a tendon, that's what is called as a insertion. Few of the muscles which are coming from the humerus, that's what it's called as a origin. So we'll be reading the whole muscle attachment into two parts. One is insertion and the second one is the origin. Now, so first we will be seeing which all muscles are present on the anterior aspect of the upper end of the humerus. Mostly these are the muscles which are getting inserted till over here. So till over here, which all the muscles are present in this region, these muscles are having the insertion, and from the lower end of the humerus, as you can see, the marked colors, the marked red colors, these all are the origin of the muscles or the muscle tendon. Now one by one we will be reading this portion. As here we can see the bone, this is the greater tubercle and this is the lesser tubercle. So the first muscle which we can see over here towards the greater tubercle, this landmarks, this is the insertion of the supraspinatus muscle. So this is the insertion of the supraspinatus muscle. Here you can see this is the insertion of subscapularis near the lesser tubercle. This is the insertion of the muscle, that's the subscapularis. On the just below the morphological neck of the humerus, superior aspect of the shaft of humerus, on the anterior side we are having three muscle attachment. That's the insertion of a three muscle. One by one we will be knowing now. The first one is the pectoralis major. So this one is the insertion of the pectoralis major. The second one, which you can see over here, this is the latissimus dorsi, and the third one is the teres major. So we can see three muscles. Once more to repeat, this is the pectoralis major, this is the latissimus dorsi, and the third one is the teres major. If I go little bit down and near the mid shaft of the humerus, this is the insertion of the deltoid muscle, and just medially on the anterior border we can see, yes, this is the insertion of coracobrachialis. So in this anterior region, once more to repeat, we are having this muscle of supraspinatus, we are having the subscapularis, the third one which we are having the pectoralis major, the fourth one we are having the latissimus dorsi, the fifth one we are having the teres major. Below of that we are having this deltoid, and here we are having the coracobrachialis. So these are the muscles which are present and getting inserted in the anterior aspect of humerus. Now slowly I am making a turn of this bone. On the posterior aspect you can see there is two landmarks, and these two just below on the posterior aspect, just below the supraspinatus insertion, we are having a two muscle. That's what is the infraspinatus insertion. This one is the infraspinatus insertion, and this one is the teres minor insertion. So these all are the muscles which are getting inserted in upper portion and the mid shaft of humerus. Now we will be seeing the muscles which are getting originate from the mid shaft to the whole lower end of the humerus. So the first on the anterior aspect, the first muscle which is getting originated. So till here is the insertion. Now we will be seeing the origination of the muscle. This is the brachialis. This is the muscle which is present in this region. This is the muscle is the brachialis. On this side, towards the lateral side, we are having the brachioradialis. So this is the brachialis and this is the brachioradialis. This is the muscle which get originate is the pronator teres, mainly the humeral head of the pronator teres, as it's having a two head. Now here you can see there is a two epicondyle, and this two epicondyle, it's for the origin of two common groups of muscle. One is, this is the medial epicondyle, this is the lateral epicondyle. As by seeing the size you can understand. From the medial epicondyle, the muscle which is getting originate, the groups of muscle which is getting originate is the common flexor origin. This is the common flexor origin, and from the lateral epicondyle we are having the origin of common extensors. Now I will make a turn on the posterior aspect. On the posterior aspect, and this whole portion is for the attachment of the medial head of triceps. This is the main medial head of the triceps, and in this region you are having the attachment of anconeus. So these all are the muscles which are attached to the humerus. So we have read the origin and the insertion as a attachment from the humerus. So when you will read about the bony parts and the muscle attachments, divide the humerus into two parts. One is the head and the upper shaft, lower shaft and the lower end. Remember, till head and the upper portion is the insertion of a group of muscle, and the lower shaft and this lower end is the origin of other group of muscle. So whenever we will be reading the muscles of the humerus, this is how we will be dividing the origin and insertion. Remember, although we talk about the muscle attachment, muscle exactly directly don't attach to a bone. It is the tendon which is getting attached to a bone, and the junction between the tendon and the bone, it's called as a tendo-osseous junction, where the tendon is to get attached to a bone. So this is about today's class, where we came to know about the muscle attachment of the humerus. As in the last class you have read about the other points, and today we have read with the muscle attachment of the humerus. With this we will end up about humerus class. In the two portion, I hope that you have already revised the last portion, that's a part 1, and this is about the part 2. So those who are watching this video, don't forget to like this. Those who are new for this channel, to learn different medical conditions including the medical educational parts, don't forget to subscribe this channel, and don't forget to support us subscribing this channel. Thanks you once again.